Hi, everyone. Thank you for joining us tonight and taking time out of your busy schedules. We really appreciate it. We have some really good topics for you tonight. This is part 2 of the Bridging the Gap from Resident to Ready webinar that's being put on by the NSDA New Dentist Committee. My name is Heather Relation. I'm the New York State membership concierge for the New York State Dental Association. In part 1, I gave a member benefits overview, and you can check that out. Along with the other topics that were discussed. They were finding and choosing a job, job interviews and contracts, negotiations, and compensation benefits and insurance. So if you didn't see those in part 1, I'll go ahead and drop it in the chat. You can take a look at that. The goal tonight is to have you leave this discussion feeling a little less anxious maybe about the next steps in your career, and for the New Dentist Committee to be able to answer your questions that you've submitted, and hopefully we can have time for a Q&A after. And so without further ado, I'm going to introduce Dr. Katie Rothis, Dr. Evan Conley, Dr. Morgan Fryer, Dr. Patrick Miccaroni, and Dr. Joe Solomon to go over tonight licensing and credentialing, transitioning from residency to practice, professional growth and clinical development, and public health research and organized dentistry.
All right. Let me just get my screen shared here. All righty. Okay, can everyone see my screen? Yes, no. Oh gosh, hold on a sec. Technical difficulties, always. Here we go. All right, we'll just do it this way. I don't like. Okay. Can you guys see the PowerPoint?
Yeah, we can see it. Maximize your screen, Katie.
Okay, cool. I just can't see you guys, so it's kind of disorienting. So no worries. So one of the big topics that we didn't get to go over last time was really kind of walking through the licensure process. We did include these slides in the follow, but we kind of wanted to go through it a little bit, and anybody of my fellow panelists that want to like share their own experiences, we'll do that, and that's how we're going to start out on this evening's webinar. So New York State licensure, what is the process? So some key things to help you out if maybe you're not staying in New York, you can go to ada.org/licensure maps. And that will provide you information on initial licensure requirements by state, including like if any kind of exams like the ADEX or CDCA are required, any like CE and renewal requirements. So once you get licensed, how do you maintain your license? And other specialty licensures and other things of that nature. Specifically for New York State, for us to apply for a license, you're going to be going to www.op.newyorksed.gov with all the, you can follow that link when you get the slides. And that will give you an overview of all the rules, the laws, and regulations for licensure in our state, as well as the actual application itself. So New York State requirements. So as of 2007, everybody who wants to apply for a licensure immediately for New York State has to have done a 1-year residency program. So all of you are coming up on finishing that this next month. Congratulations, very exciting. So that will be one component that will be submitted for your licensure, like verification to receive a license. Other things, pretty general, good moral character, very similar to when you're applying for dental school, have to be at least 21 years of age, and they meet the education requirements, examination requirements, and experience requirements. And then any kind of coursework. So a lot of times, I know for NYU's, which is where I graduated, a lot of courses in our 4th year of dental school, we had to take like child abuse and our DEA safe prescribing practices. Some of you may have taken those courses while you were in residency. So make sure you have your proof of certificate of completion of those courses, because those are basic requirements for licensure, and you must supply proof of completion of those courses. So things to know, major things that you're going to have to be able to, again, provide copies of when applying for your license. It's going to be an official transcript, your board scores. So that's going to be, I think all of you at this point have your, integrated board scores. When I was going through the process, I still had boards part 1 and part 2, as I think most of my other fellow panelists also had. Again, that child abuse training completion certificate, and also your most recent BLS certification. Now, for whatever reason, if your school didn't have you complete any of these trainings, or your residency did not have you complete these trainings, the child abuse training, the New York State Department of Health does have a free online module that you can complete that satisfies this child abuse training, and basic life support. Local dental societies frequently host basic life support courses. American Red Cross does. There's a lot of resources out there. If for whatever reason you haven't had, usually most people had to do it for residency, so that's good for 2 years. So you should be good. Again, just find that proof of certification for that. Okay. And then you'll have to do some other basic information like, your education history, basic contact information, and things of that nature. Very similar, again, to the application for residency and the application for dental school on all your kind of basic background, academic and personal information. So the process. So again, the website link that is here has all of the forms and documents that you will need to complete that are components of your application. If you have a social security number, your application, you can save your application online for up to 30 days. So you can start as many components of your application as you have available to you. You basically get an account, and then you can go back onto the website at any time over the next 30 days and add additional information, or like make your payment or other things like that. And basically have your application ready and set to go for that final component, which will be a verification of completion of your residency, which usually your residency director completes that and mails it directly to the New York State Department of Education. So you don't have to worry about that one. So there's a couple of forms you have to fill out. So like the initial licensure application, again, that's pretty basic information about yourself. Certification of professional education. Again, that form must be submitted by your educational institution, meaning your where you went to dental school. So that is a form that your dental school has to complete. And they will send that in conjunction with your transcript. So very important that you understand and know what the process is for requesting a transcript from your dental school, and then also finding out who the most appropriate person is or email address that you should be sending this certification of professional education to. Again, I think for me at NYU, it was the main campus, like across the whole NYU, the registrar or bursar office that was in charge of releasing the official transcripts, but I had to go to a different person, like in academic affairs at NYU in the dental school specifically, to fill out that certification of professional education. So, now's a great time. You've got, a little over a month or so. Reach out to your academic institutions and find out what that process is and who you have to send things to, or what email address that you have to send that documentation to, because it can sometimes take a couple of weeks for them to process that paperwork. Your initial licensure fee is going to be $377. So for those of you that, are keeping the budget, keep that number in mind when you're looking at your monthly expenses for the upcoming month. And that's paid by credit card at the time of application. And that includes both the application fee and the initial licensure fee. And your license will be good for a 3-year period. Okay, so here are all the forms. Like I said, you're going to have that application for licensure, and that's where you're going to also have to submit your proof of mandated courses and your basic life support. It will also it will prompt you to make your payment, and then you want to make sure you save your application number, because that reference number, if you have an issue, logging into the application after the fact, or you need to call the New York State Department of Education during the process, they're going to ask you, they may ask you for your application number. So definitely save that in a safe place that you can reference it if you need to. Again, like I said, certification of professional education, make sure you know your school's process. If you have any other professional licensures or certifications, like perhaps you were an EMT or had some other kind of certification that might be relevant to applying for your license as a dentist, that is what Form 3 is, but you may not have it. I certainly didn't have that any kind of documentation to submit for that one. Personal affidavit of professional practice for endorsement applicants. That form is for somebody who you don't, again, you as a resident, you won't have to worry about that form either. That one is more so if somebody practiced in another state with a license and now is trying to come to New York through the reciprocity process, is when a personal affidavit of professional practice endorsement is required. So you guys don't have to worry about Form 4. Same thing with Form 4A. Form 4B, that is Section 1. So in some cases, your residency director will provide you with the first page of this document, which is what you fill out, and they fill out the second page. In some instances, they want you to be proactive and fill out the first page yourself and upload it. And then they will have you fill out the first page and then they'll hold on to it. They'll fill out the second page and they send both the pages to this Department of Education. So for Form 4B, I would definitely, reach out. If your residency director hasn't mentioned it at this point, not a bad idea to kind of ask them about it and see if you need to do anything or be proactive with that form. And then the other ones, like Form 5, again, you don't have to worry about Form 5. That was what your residency director applied for you on your behalf to be a resident. And then your child abuse certification of, if there's any kind of reason that you should be exempt from the child abuse, there's a form for that. And then if there's any kind of reason that you need to be exempt from being trained in CPR, that's another form. But again, most people, that's not going to be applicable for. So mainly we're looking at online Form 1, Form 2, and Form 4B to apply for your license. There's a really great frequently asked questions page in the New York State Dental Education, the New York State Department of Education's website. So you can always go visit that page if you have any specific questions or further follow-up questions. And then you can also look at the requirements at a glance. It's a link towards the bottom of that page that you can see here. And you can go over and kind of go over like a checklist. Okay, do I have this? Do I have this? Do I have this? Great, I'm ready to go. And last thing, how long will it take to get my license? So on average, and this is according to the New York State Department of Education's website, once you have every component submitted, so once you have all the forms that you can do online, and once they receive your transcript from your school, and once they receive the residency completion form from your residency director, once all those components are in the hands at the New York State Department of Education, from there it will take about 4 to 6 weeks. New York State Department of Education does provide updates on when applications are reviewed based on date of submission. That will typically, so as you can see here, you can log on to their website at this web link. Again, this will be in a follow-up email, but there's literally on their website, they have a place where you can look at the status of where they're at and you can't see your specific application, but you can see based on when you submitted the application, if they're reviewing that batch of applications. So when I took this screenshot a few months ago for this presentation, they were reviewing applications that had been submitted on April 1st, 2025. So that can at least give you kind of a sense of how backed up the process can be, because it is pretty manual, despite us being in the 21st century and having a lot of, streamlined online processes. And despite the fact that they do have online submission forms, a lot of the process on New York State Department of Education side of things is still pretty manual. So it can be, expect for it to take that, closer to 6 weeks to get that license completed. But like I said, if you start this process now, this is a great opportunity. Like I said, they'll hold your application in their online system for the next 30 days. So by that point, you should have it. That should be enough time for your transcript to arrive from your institution and for your residency director to complete their form. And so, once all those things, kind of sits, your application sits in a queue in a virtual pile. And once all those components are there, it will push the process forward. So as much as you can do ahead of time, you'll be a better place in line once those final components come in. So that's what I've got on licensure. Anybody else have any other personal stories or advice about applying for a license?
The only thing I would mention is if you're staying in New York State, I'm the membership concierge for New York State Dental. We check the licensure website routinely, especially in the summer when you're all getting licensed, we check it daily, and there could be upwards of 50 a day. We email every single one of you, so it's important to make sure that your email is correct. I know Florida does the same thing, but that might not be for every state. Something we started doing years ago. So keep an eye on your email too, because I might let you know before you even have checked. We try to really stay on top of it to let you know. And then we'll ask you if you aren't a member to join at that point, update your information and let us know where you're going. So even if you're going somewhere else, but you still have a New York State license, we will let you know. So that's just something to keep an eye out for as well.
And I would say if you are applying for licensure at a different state and you have questions, reach out to the State Dental Association if you have questions, if what's on the ADA's website is not enough, if you need some more additional detailed information. That's what the State Dental Associations, they're there as a resource to you to help you become licensed in that state. I know too, sometimes if there's been, issues, or I know I was applying for a license during COVID when things were very backed up because of staffing issues. And so there were, I had colleagues and myself, sometimes I had to call the dental association and be like, hey, I don't know what the holdup is with my license. And I was having problems getting through on the phone. And so people at the New York State Dental Association were able to, they weren't able to push the application any faster, but at least they were able to get some answers as to what the status was, or if there were any, hiccups or holdups as to why the license hadn't been processed. So keep that in mind as well.
And I would just like to reinforce exactly what Katie said in her slides, that, I remember in my experience, someone had mentioned to me to early on get started with the application process, which I did. So I think I was pretty high up in the queue. And by the time all of my stuff got, pushed through to the education department, I think I received mine closer to 4 weeks. It was quite quick. So I would just highly recommend, you're going to be way ahead of the game getting started a lot earlier. If you do these things, it's definitely worth it, as opposed to people that waited until kind of like the 11th hour. They didn't get theirs for, I'd say sometimes even closer to 6 to 8 weeks. I'm not sure if anyone else had that experience, but that's what I kind of heard. So excellent slides, Katie, for sure. Agree with everything.
To echo what Patrick had just said, I filed for all of my stuff that I could do second or third week of May, and I received my license the second week of July, so about 2 weeks after finishing residency. And I did find out from the NSDA email That was the first thing that I saw, and then I went on and checked to verify it. So definitely make sure that you guys have your ADA account has your updated contact info. Go in there and make sure that that is all updated so you can find out, because you might not otherwise know, like Heather had said.
Mm-hmm. Awesome. Very good. Because otherwise, think about it. We've got hundreds of residency programs, thousands of residents graduating. So for those who aren't ahead of the game, sometimes you're there with 1,000 other people, and so you're waiting until September, October till they finally process that license. So
yeah, that's not an exaggeration. I do see ones in September and October, and that can be painful waiting for that. One other thing I would mention is if you are staying in New York State, we have CE Navigator. So once you are licensed, you can download it. It's a free app, so you can track your CE. You can take discounted CE courses through us to maintain your license too. We'll give you more info on that at a later time. Just know that that is available to you as a member.
Mm-hmm. Awesome. All right. Well, I think that's
Katie, if I could,
yeah, go for it, Joe.
One thing I wanted to go off of with what Katie was saying, when one of her first slides was the PGY1 law was put into place back in 2007. And, throughout your guys' dental school career, you've probably heard lots of things, that there could be changes at the state level or changes in terms of the licensure process. Will PGY1 stick around? Will there be a movement to maybe offer dual paths to licensure, like a PGY1 or taking a board exam and stuff like that? And I think it's just important just for perspective. And the one thing that I wanted to add is as you guys graduate from and matriculate from your programs and start working towards licensure, when you hear colleagues that, talk about early on in their careers, challenges that they may have, or, things that maybe could have been done differently, a lot of these comments and thoughts kind of percolate their way up to the state legislature and stuff like that. And, Katie has much more familiarity with advocacy and legislature and those types of things, but where she runs into some of those talks with what they propose in legislature and stuff like that, it doesn't come from anywhere, right? It comes from comments that come to these legislatures, right? And it comes from, these things come on and percolate their way organically for consideration changes to the laws and stuff like that. And, one thing I've noticed from sitting on our local dental board, along with, Evan Conley and stuff like that, is just that, we do have a licensure committee, and they report back on a monthly basis about things that are happening at the NISDA level amongst all the different dental societies, and, things that, changes or recommendations that might be making their way to the state legislature and stuff. But a lot of guys on the dental society are, my age or greater or and stuff like that. So I'm kind of removed from my PGY1 years and stuff like that, and, taking boards and everything. I was the last class from the state that had the dual option of either doing a licensure or still taking the board exam. So we still had, two pathways and stuff like that. So it's definitely important. And I'm just advocating for you guys to stay active and stay active with your local dental societies and stuff like that, and voice your comments and concerns early on in your career, so people are listening and taking your words up to the state level and stuff. Otherwise, change can't happen in a vacuum, and change that affects those who are graduating after you guys, you want to try to pave the way forward. And if there's challenges that have been had at the dental school level and stuff like that, or in residency, make sure you let your local dental societies know that, because they're always willing to listen, and they're going to bundle those comments together when it comes to lobby day and advocacy day and those types of things. So just a little plug for staying active with your dental societies. Okay.
Mm-hmm. Thanks for that, Dr. Solomon. And for me, I am the New York State Dental Association's new dentist trustee. So when major decisions for the organization are happening, I represent your voice. So my email will be included in the follow-up email. So if you ever have any questions, suggestions, things that you think that the organization should be focusing on or prioritizing, or that we're neglecting, for our early career dentists, please reach out, because I represent all of you, and we want to make sure that you feel supported, and you have the resources you need to be successful now and throughout your career. So keep those things in mind. But anybody else with any other comments about licensure? No. All right. Let's move on to our next topic of the evening, and that's the transitioning from residency to practice. And so, we kind of wanted to get some input about like mindset and workflow differences from residency to the real world, different treatment planning considerations if you're working with a different patient population or you're in a different location than you've been in dental school and residency, and working with different insurances. So Dr. Connolly, Evan, do you want to kick us off with that?
Yeah. So something that, I found was a big jump for me in practice was I went from a residency program that was affiliated with a hospital in a very, disadvantaged community. We are one of the major Medicare, Medicaid providers for the area, effectively a safety net for the neighborhood and surrounding regions. So a lot of our patients are, very much, they could only, proceed with things that were covered by their, state insurances. And those are very different coverage guidelines you'll find than a lot of private insurances. So, in situations where, you would recommend endo versus exo, the endo is not covered, you're doing a lot of extractions. So you see a lot of x-rays and you start thinking, by the end of residency, there's an extraction, there's, it skews your treatment planning mentally a little bit. And that's something that you have to keep in the back of your head that, especially when you're, you always want to give all of your patients every option possible, regardless. But don't let, previous coverage history then, skew how you offer, how you discuss with patients, because especially in private practice, you'll encounter, self-pay, private insurances that, have even implant coverages and things like that, that your, residency program might have trained you, that there is no implant coverage with insurance because, no, the state insurances do have that coverage. So those are things that you want to make sure you're researching, when you're in an office or practice, know the ins and outs of what is covered so you can, as dentists, you don't want to be having the financial discussions with your patients. You want to have the clinical discussions, but it always comes up, when a patient says, well, that's a lot more costly, isn't it? Or that probably won't be covered, right? And you want to be able to be upfront with your patients and let them know, both what you recommend and, give them an idea of what they're getting themselves into so they're not blindsided when they go to a specialist's office or, you refer them to an endodontist and then the endodontist tells them what the cost is going to be and they're, all of a sudden mad at you. You want to avoid those things right off the gate. And just, your workflow and efficiency is going to be totally different in the offices. A lot of times private offices have a lot more hygienists than maybe you were used to working hygiene checks in residency. I know our residents, when we have 3 hygienists in our clinic, sometime in one resident, we rotate the residents on hygiene. And they say, I hope we never have 3 hygienists again, or, that was overwhelming. And it's, there's offices where there's 4, 5, 6, to one doctor doing exams. So it's just something that you have to start wrapping your head around, different ways of practice and different ways to become more efficient.
Yeah,
and you brought up one thing that I just really want to just not get too off topic on, but documentation. Take it from someone who's been doing it for a while, and then somebody's going to come in and they're going to say, hey, didn't you say I could have done a bridge? And you're like, I can't remember. Just like, making sure your treatment options are in your documentation, devoid of what Dr. Conley was saying, devoid of what's covered and what's not covered. Just make sure you have a conversation, you document that you had a conversation with your patients. Your options are endo, extraction and bridge, extraction and partial, extraction and nothing, that type of thing. Just make sure it's at least in there that you're getting it out there, that you've had a legit conversation and you're emphasizing patient autonomy. Despite someone being in a safety net setting or seeing you and only being able to afford what insurance might be covering, make sure that they're aware of their options, regardless of their ability to pay. Just want to put that out there real quick. But yeah, excellent points, Evan.
Yeah, and Evan, I would just totally piggyback off what Evan said. Is I feel like just another way of putting it is being very sensitive to, and especially in private practice, the how the insurance will not necessarily impact what we're recommending, but how the family will have to pay for it, or the person will have to pay for it, what that is. Because, I remember the first week I was doing, and I'm pediatric dentistry. And so, I had a kiddo, and, I was used to doing, 2-quadrant dentistry at the time. I busted out, sealants on 6-year molars and a couple Mo's and Do's on, did an extraction and an impression for a space maintainer. And I thought I was doing the family a favor by not having come back again, but I didn't realize that particular insurance that family had, they actually paid up front for all of that and then got reimbursed afterwards. And I didn't have a high level understanding of that. So they're hit with a bill for $800, $900 they weren't expecting, usually due right up front then. And you can imagine how terrible I felt, how terrible the family felt. And we got it all worked out, but it could have all been avoided had I just spent a little bit of time being sensitive to how that office worked within the insurance and how the family would be responsible financially. So do your homework, talk to your office manager, talk to the owning dentist, and just make sure that you're understanding. That way you can still present that as an option, but they'll have they'll be sensitive to the fact that what they would have to be expected to do if that was the case. You don't have to know the particulars, but Evan, I think you just hit it on the nail there.
Morgan, any thoughts about, how things that you kind of had to adjust to when you transitioned from residency to practicing?
Yeah. So for me, I feel like I'm in a unique situation where I personally work with my older sister. So of course, a lot of people compare us. We're about 9-10 years apart. So it's something where I'll never have as much experience as her, as much time in private practice. And of course, being straight out of residency, if people had to choose between us, they would choose her. Even still to this day, going into my 10th year of practice, people will still question us, who's older, who's better. So that being said, if you're going into practice with a family member, or even if it's not a family member, some of those offices that are used to having just one doctor that you're stepping in with, or just 2 other doctors, and you're the youngest, least experienced, just be prepared for people to pass on you and to say that you're not experienced enough, and that's okay. There'll be plenty of other patients who are willing to work with you, and slowly you'll gain their trust and grow your patient base. It's just all about making good first impressions with those patients and being confident.
Yeah, that you bring up a good point. I know when I first got out, I would say probably 85 to 90% of my patients, when I first met them, are you old enough to be my doctor? Yeah, they was just are you sure you're the doctor? And I always people when they ask me, how long have you been practicing? I counted my years in dental school seeing patients, because I was doing procedures. So when you're coming out of residency, whether you did 1 year or 2 year, you've got technically 3 to 4 years of experience. So just don't, and people don't understand that concept that unlike physicians, we start seeing patients when we're still students. So when people ask you, count those years as years of experience. And that will also, I think, alleviate people's yeah, I may have a baby face or look young, but I've been doing this for 3 years. And that will, kind of help ease their concerns or, maybe misconceptions. But you will have imposter syndrome. I know I did. I felt I was super hypercritical of my fillings, or when a patient, I couldn't get good isolation. I'm oh my God, this filling is going to be terrible. And all these things, and you just start doubting yourself. Or God, I wish I still was in residency. It will happen. It's okay. We've all been there. Just take a deep breath. And know that, you have the skills, you have the training, or sometimes, be honest with your patient and be I'm not really happy with this. It's okay for now, but I would really like to bring you back, to make some modifications to this, because I just don't feel like you're going to adequately be able to floss between this, or I don't like how it looks. You might have to sacrifice and do some stuff for free as a redo, but you'll feel better about it. And your patients will appreciate that too. Again, that will build that rapport and that trust when you're honest with people, when those kinds of things happen. So I also, things will happen. Like you will, I know for me, when I first transitioned, I overestimated my skills. There was definitely some cases where I was like, yeah, I can take this tooth out. And I could not take that tooth out. I was like, looking back at the x-ray, like, after the fact, I was like, oh, you know what? That bone is actually really dense. And I didn't really closely like appreciate that on the x-ray when I was first looking at it. Or you know what? Those roots are kind of bulbous looking, or they do kind of have like, there is a little hook at the end. So things like that it will happen. Make sure whether you're, in a practice by yourself or you're with others, make sure that you know who to refer to, whether you can call upon one of your fellow doctors in the office to help bail you out, or if not, you have a specialist and you know what kind of relationship you have with him. Like if you're stuck in, like, you have a molar that you started and you got half out, but it's still half in there. Do you have an oral surgeon that you can just call up and be like, hey, this is my situation. Can I send my patient over there right now? Or, can I like suture them and stabilize them and then get them scheduled with your office and put them on like antibiotics, pain medication, and that kind of stuff. Those kinds of things, be like, anticipate, like, what am I going to do if something goes wrong? Because ultimately, again, something will, you'll get stuck, and that happens. Even some seasoned people get stuck sometimes, but as long as this is what I can do to save my patient and to save this experience, and make sure the patient still ultimately gets the treatment that they need, that will help you if you have those plans in your mind before things happen. So anything else, everybody else got anything about that? I think I had to talk about early challenges a little bit already.
Morgan, that was a really good point, and something that I'm going to try to do a better job of being cognizant of. Like I have 7 dentists at our clinic, at our program, and I'm in charge, but I'm kind of like Malcolm in the middle. I've got like dentists that are older than me and dentists that are younger than me, and two of my newest hires, one is graduated their residency last year, and the other one graduated residency 2 years prior, and they came directly to working for our tribal health center within Indian Health Services for Seneca Nation. And I think if I could, they've always been very, they've been very willing to try new things, and willing to try new procedures, and kind of knowing that I've got their back. If I'm, hey, I'm going to try something different with the laser that I haven't done before. If I get into a jam, I'm like, oh yeah, I'm 3 doors down, just find me, that sort of thing. But I think, if you join a practice or a group where there are other providers, trying to establish that level of comfort with someone with a few more years experience than you, and, talk to them and just have an honest conversation about where you feel like you're at with your skills and stuff like that, and things that you'd like to maybe improve upon, and ask them, hey, if you get a case of something or whatever, like I'd really like to do more bicuspid endo, 2 rooters exactly, and then just ask them, hey, if you see one of these, could you send it my way? Could maybe we work on it together or something like that? Or, if I get it cleaned out, can I watch you obturate it? That type of thing, And I think just trying to have a good relationship and stuff like that. Like, don't treat the end of your residency as like the end of your learning process. Like, I'm done. I don't need ACEs for 3 years, like that sort of thing. Just it's literally a lifelong learning process. I'm constantly asking the oral surgeon who's 20 years older than me. I'm constantly asking the general dentist who's 30 years older than me for just something new, just something that I saw you do something different with the bond. What was up with that, And it just gets a conversation going. So just don't be shy. Your coworkers or your colleagues. We're all in this together. Like, nobody has a manual for how to practice in their first year, or anything like that. So just we're all in it together, and we've all been there. So just lean on your colleagues as much as you can, without being annoying.
You also have the new dentist committee and your local districts also. So if you're finding that you don't have, or you don't feel comfortable maybe talking to your colleagues, maybe you just feel like you want to talk to somebody that's closer to your age or who's been experienced, this panel right here is an amazing resource. And also your new dentist committee representatives in your local district, no matter where you go in the country, find out who they are, call your local district, call your state, and find out who they are, because you'll find somebody undoubtedly in your specialty to be able to bounce ideas off from. And that's really the benefit of being a member, is having that mentorship option. at your fingertips. So take advantage of that too. You're not working in a silo when you're part of the organization.
Mm-hmm. Same thing goes with your classmates and your co-residents. Like if you have a relation, like my friends from dental school send me images all the time being like, hey, how would you go about like, taking this tooth out? And I would be like, I'd send that to an oral surgeon, or like, this is what I would do in that situation. So there's always that opportunity to, or like maybe some of your friends from dental school went into a specialty. Lean on those resources. Like no one here is an island. And we all, like to share our own knowledge and stuff and advice, or like, skills, or again, if you have friends who went to other residency programs, maybe they learned something different, or like a preceptor did something different technique, different instruments, like, coming to practice, like someone that I work with was like, I really like this thing called the spade. And I'm like, ooh, what's that? We bought them, life-changing. I love that thing. I use it on every single extraction. So like, those are the types of, people you've got a bigger network than you think, to utilize, during your, practice. So, Morgan, do you have any other things that you wanted to talk about as far as like early challenges and strategies for successful first year out?
No, I think we pretty much hit on all of it. I think the big takeaways are, like you had mentioned, building relationships with those specialists, and then just being able to work on your clinical skills, be open to case review, either reviewing things on your own or with mentors and peers. And those are the biggest things for my first year out.
Awesome. Very good.
And,
And
I would
then
just say for imposter syndrome, sorry, Katie, just for imposter syndrome, I think it's a big two-way street, because if you're practicing with people who have practiced long with you clinically, they're going to be very, very far ahead of you. They've made the mistakes, they know it, so lean on them for that. But I think to also realize that you coming out of residency, you know things that they don't, and you've been trained on things that they don't, and you have a lot of worth and value to bring to any practice, and it's a two-way street. So while you're leaning on others, form your networks and your specialists, just realize that you have something very special to bring to the table, and that you're going to be a huge asset to any practice, and that your patient, things like that. So don't let it discourage you when people are going to be clinically, they're going to know their stuff, and you should lean on them for that. But you also bring a lot of value to the table, I feel like, too. It's a hard thing to navigate with that imposter syndrome / wanting to be the doctor, but also wanting to lean on people who have had more experience. So, everyone's there to support you, I think, at the end of the day.
Yeah. And I think, people like people who are graduating dental school today, and residents especially, you guys have more comfort working with patients who are medically complex and patients with special needs. I can't tell you how many patients I get at our health center that got turned away from private practices or other practices in our area, because like, oh, you're on a blood thinner. I know we don't treat that here. We need to refer you, or like, very, very things that were like very straightforward in my mind. I was like, I know how to treat medically complex patients. Like, we just need to ask for this lab and this medical consultation, and we're good to go. Like, or like, I don't need you to hold your blood thinner. Like, I can just put some Surgifoam in there and like make sure that you stabilize before I send you home. So like those kinds of skills, or like working with patients with anxiety, or on the spectrum of autism, like I don't need to refer those patients for sedation, because I learned those, how to work with those patient populations in residency and in dental school. So those are things that, really, reflect on those experiences that you had in residency, and know that those are definitely skills that you have, that many others practicing don't. So those are some things that give, like Patrick said, you bring something valuable to the table as well as a new grad and a new grad early career dentist. So Patrick, did you also want to talk about some stuff related to mistakes to avoid and lessons learned?
Oh yeah, I think especially but I think this happens in a lot of fields in general dentistry as well. But a lot of emphasis on pediatric dentistry, especially, is built on a lot of people will talk about their speed and how fast are you and that kind of thing. But I think for me, the most important thing that I've learned is actually the opposite. I think to build your craft and your quality first, and then your speed will come. Because if you don't have quality, then you can be as fast as you want, but you're at the end of the day, it's not the best for your patients, and it's also going to cost you more on the back end because you're just going to be redoing stuff or have negative outcomes. So one of the simplest things I can even recommend for a new grad that I thought would be very, very helpful. We actually have a new grad right now in our office that we just hired, and I recommended he do this, and it's been fantastic for him. Is, you know, for the first few months out, I think it's really a good idea to take some immediate post-op X-rays. Check your work. Check if you're concerned about a margin. Just, you know, don't charge the family or the patient, but get in there and get that X-ray and just see how your work is looking. Make sure that it's the quality that you want, the quality the patient wants. And my new associate, for example, I mean, he's been great. 99% of his work's been awesome, but one he felt a little funny about, took a post-op X-ray in a class 2 on tooth number 4, and yeah, had like an open margin there, whether he missed caries or just, you know, the matrix didn't seal correctly or what have you. So I don't know if you all agree with that, but I just think that honing your craft early on and really focusing on that quality is going to be much more important. And I wished I had done that even more looking back, you know, taking those post-op X-rays immediately and really, really, you know, rather than waiting 6 months out or a year out to see what it's looking like after and then adjusting.
Yeah, I totally agree. You're better off trying to push for that early yourself versus waiting for like someone like me to look at it on a chart audit 3 months later and be like, what gives? You know, we build this out, and if someone looked at this X-ray, you know, we're gonna have to redo this. Or a year and a half later when someone's back in for bite wings and we see something that was done that has to get replaced. You know, I mean, you know, don't be ashamed to just say, yeah, hey, let's just take an X-ray of it. You know, I mean, but having immediate or almost immediate feedback is something that I wish I would have done much earlier on in my career. You know, where I was, locations that I was at, you know, were very heavily insurance based and stuff like that. You know, the office manager wanted every single X-ray build and stuff like that, and I really wasn't in a position to start challenging the status quo and doing a lot of free X-rays and stuff. But you know, I could check my margins with floss. I could blow the air in there real good, look with flash and stuff like that. You know, yeah, exactly right. You know, if you're catching something with your floss, you know, get in there with your interproximal strip, those types of things. You know, like, so, you know, just evaluate your work a little bit more early on than just articulating paper. You know, like get your Explorer in there, blow the air syringe in there real good, you know, like that type of thing. Shine the curing light on it again. You know, I mean, like a curing light is a great tool for showing you if you're not adapted fully, you're going to see a shadow around your cavo surface margin and stuff like that, you know? So, you know, there's little things you can definitely do early on, like what Patrick is saying, to just, you know, just give you guys some initial feedback. And it's not to say like, oh man, I got to replace this. You know, perfect is the enemy of the good. Like when you guys graduate, when I started, I was good. I'm still, I think I'm still just good. I'll never be perfect. None of us will ever be perfect. You know, it's impossible. We're not textbooks and we're not textbook authors, but don't let perfect be the enemy of the good is what I'm trying to say. So like, if you're like, oh my gosh, like that, I could have just, you know, ditched out that tertiary anatomy just a little bit more, you know, like that's, feedback, you know, let that be your feedback for your next thing. Don't be like, all right, we got to drill this out and start all over again. That's not in your patient's interest, not in your interest and stuff like that, you know, unless there's a critical error that's going to be symptomatic or have a problem. But, you know, I was always really upfront with some of my patients when I first started working in a really large group practice with 12 other dentists. We were all part-timers. We were all just, you know, getting whatever we could. And I know this goes back to our insurance discussion about fee for service and fee for schedule and house fees and working as an independent contractor and stuff like that. But, you know, I was always really upfront with my patients. I would say to them, if there's an issue, let me know. I'm more than willing to make it right or take care of it or something like that. You know, I think I would just always never like give someone a guarantee. You know, we can't guarantee our work. We're not like, you know, it's not a car wash or something like that. We're not detailing cars. If you're not happy, bring it back in 7 days or something. But like, you know, just let somebody know, hey, if that bite feels a little high, you know, I did the best I could, you know, give us a call tomorrow morning. I'm more than happy to squeeze you and adjust that bite or something like that. You know, if somebody comes in with a hot tooth, especially if it's a hot tooth, just say, we did everything we could to get that pulp to calm down and stuff like that. If it's still bugging you, let me know, you know, and if you got to go in there again and do more of a pulpal debridement, you know, do it. And if you got to take the hit on your production and stuff like that, like you can't walk out the endo because you didn't finish the endo, you know, just it's a practice builder. Sometimes the things that you can't walk out. One of my very first mentors said to me, you know, years ago, it's not what you do today, it's what you treatment plan for tomorrow. Okay. So, and that doesn't just pertain to your hygiene exams and stuff like that. Okay. Hey, oh man, I treatment plan 10 fillings. This is gonna be great, but like patient comes in super hot tooth and stuff like that, they're kind of in between. Should I extract it? Should I root canal it? Something like that, take down the occlusion, get them numb, get them on an antibiotic or whatever, if it's indicated. And then just say to them, here's your two options. I'm here for you. Let me know what you're thinking, And then I would say back to my boss, Manny, I would say, yeah, I only got the x-ray and the limited exam done and stuff like that. I could have gotten that tooth out, but he'd be like, well, they might come back in 2 days and want to do the endo, the post, and the crown. And that's $1,000 in your pocket, Joe, like that sort of thing, So just think about, now, obviously not the money, but it's not what you do today. It's what you treatment plan for tomorrow. Give your patients that autonomy and stuff like that. And sometimes just not billing out a procedure or not doing a ton of work is a practice builder, because they're like, wow, this guy didn't want to just yank my tooth and stuff like that. I'm not speaking clinically, I don't say yank at work, but someone's going to go home and they're like, hey, how was that new dentist at so-and-so's office? Oh yeah, they're really young and stuff like that. But Joe just said, I'm just going to do the x-ray and take your bite down. There's not going to be a charge today. Think about what you want to do. I'm here tomorrow. I can pull that tooth. If you want to come back next week, we can root canal, and they'll be like, oh, wow, that's nice. So he didn't want to just pull your tooth out? And they're like, no. And so we're always walking into that room with a target on our back. Nobody likes the dentist. Like it's just, unfortunately, we do have that connotation and stuff like that. People, there's a degree of fear. There's a degree of trust that has to be built. And especially as a new provider, you really have to really emphasize building that trust early on and stuff like that. And some of you guys may not be at the same office your entire careers and stuff like that, but you have to treat every first encounter with that patient as just letting them know that you're there for them, and you're not just thinking, what can I bill out to your insurance? What can I produce for the week and stuff like that? Let them know that you're there for them. Soapbox, I'll get off.
No, thanks, Dr. Solomon. Okay, so with that, we're going to transition. We have two more topics. So this next two, we're going to do kind of rapid fire. Because we did start a little later, we will go to like 8:45-ish. We want to be mindful of people's time and other things they've got planned for this evening. So for these next couple ones, I'll just go around and have everybody kind of like give like one or two, answers or responses or thoughts, and then we'll keep moving through so we can get through how do we keep learning after residency, and then also have a little bit of time at the end to talk about public health research and organized dentistry moving forward. So going around the room, I'll start with Patrick. Any advice on the best CE courses that you took or that new grads should kind of look out for? You're muted. Yeah.
Sorry, thanks. My general advice would be, it's a little bit different for me as a specialty, but I would say just pursue what really ignites your fire, what gives you passion, and try to pursue that, because at the end of the day, you want to be happy in your practice. And so go with what you're passionate about. That's my quick fire response.
Awesome. Morgan?
Yeah, I would say, if you have a local mentor, see if they have any suggestions for local like study clubs and such. In the beginning, you're just trying to get your feet on the ground, and sometimes the courses can be a little bit daunting because you don't know what you don't know. So take everything with a grain of salt. It's great to attend them, take everything in, and hopefully implement it eventually, but it's okay if you don't implement it immediately.
So, Evan?
Just to somewhat echo that, start small, know your limits early on. It might not be the wisest to go out and spend a ton of money on this big implant CE if you're in a practice that doesn't even have a cone beam, or, things like that. Think about little things that you can implement into practice right away. You might have run into a clinical situation yesterday that you would like to handle differently moving forward. See if there's some CE on, improving even like, just general restorative dentistry, or, general things to help keep you, on your game. And just be mindful of the source of the CE or where you're getting your information. There's a lot of like Facebook groups out there, and some of them, are very sponsor heavy, and it might not be the best clinical evidence-based discussions. So just make sure that, you're using that critical thinking background that you were trained and taught in dental school and to evaluate sources, because this is what it's for. You are learning forever now, lifelong learning, and you have to be able to evaluate those sources and make sure you're vetting the information that you're learning from before you apply it to practice on your patients.
Great answer, Evan. Joe?
All of the above, what everyone said. But when you go to these meetings or go to a really big CE or something like that, or if you're at like the Buffalo Niagara meeting, or if you're at like the Yankee Dental Conference, the Greater New York or something like that, or even if it's like just like a webinar type thing where you're looking at a bunch of webinars, if you could just take one thing from what you go to, I know that they give you 3 or 4 learning objectives, but if there's just one thing, even if it's not a learning objective, just like something new, like a new way of like, oh, I never thought about doing that with the etch. That seems a little different or something like that. If you could just walk out of something with just one thing, then that's just one thing you're putting in your toolbox and stuff like that. Sometimes it can definitely be overwhelming, and especially when you're in practice, all the magazines that start coming, Dentistry Today, blah, 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 this and that, the other thing, there's like a bajillion free magazines that just keep coming and stuff like that. They do have CEs and this stuff, very much like what Evan was saying, considering the source and stuff like that. But, if, sometimes I get in the bad habit of just taking them and just throwing them right in the wastebasket. If you at least crack it open, you might just expose yourself to just a new procedure that might just, open up some ideas and stuff like that. So I would say just keep an open mind, but then also, don't let your head fill up with a ton of things. If you can just filter it down, and if you can walk out of a CE course with just one new thing that you've learned that you can carry with you, that's definitely my advice on CE.
Awesome. Great advice. For me, do some reflection. What skills do you feel like as a general dentist, you still feel like you need some additional hands-on or just additional knowledge you want to learn? And then what is something like you might think, like, what is something new that you want to learn, and kind of focus on those things. So for like me, I also always go to the Greater New York Dental Meeting on the first Sunday, because a lot of us as new dentists, can't afford necessarily or don't like to take days off of work. And a lot of other hands-on courses or other lectures are during the week and would require you to take the day off. So I've tried to reserve doing like hands-on stuff at Greater New York, because I could go down on a Sunday, stay for the day, and because I'm in Albany, I could take the train down, take a course, and then take the train back on a Sunday. And that was great. And they always send those, course catalogs out really early, so you can see what's happening. Like I've done some pedo courses, so I could be more comfortable doing stainless steel crowns. This last year, I've focused more on endo courses. I know I learned like Hall technique. It was great. But yeah, like, so I started with that as like first, because I saw like the patient population I was treating, there's a lot of kids. So that's where I kind of focused my initial CE. Now I've tried to get more into like building my endo skills. So I've been trying to take some more hands-on endo courses, and also just like lectures about like endo for the new grad, or like endo for the general dentist, and like how do you kind of treatment plan, or do case selection for those. So that's kind of how I've kind of looked at myself internally, like what skills do I want to improve upon, and then just trying to find conferences or organizations like the Academy of General Dentistry, a specialty organization who's hosting those kinds of lectures or hands-on courses, and kind of making those decisions if it's local, if I'm traveling, and things like that. Also conferences, there's for every specialty as a conference. Like Joe and I will go to the National Oral Health Conference. I'll go to the National Network for Oral Health Access, which is for federally qualified health centers, which has both CE for, professional like practice management kind of stuff, as well as some hands-on clinical stuff. So kind of just like, there's a lot of stuff out there. Just kind of look at, what your personal goals are. There's a lot of free stuff now online too. There's like CareQuest offers some really great lectures about different like smart techniques and non-invasive dentistry, as well as like working with different patient populations. So there's a lot of different stuff out there. ADA has free stuff. NISDA has free stuff. Some of it's like online, on demand. Other stuff is like webinars that are hosted on a monthly basis. So keep an eye out for those. If you want to invest in it, I invest in spear education. And so they've got some really great lectures in different, study clubs and stuff. So there's a lot of stuff out there. You just kind of have to pick and choose things that you like, and kind of, again, decide what is important for you this year. And also use your CE Navigator to see which courses you need by the time you re-up for your license in 3 years. There's infection control that you have to do regularly, practice management, child abuse. So there's other stuff on there.
I put those in the chat. For CE Navigator, there's a link to that. There's a link also to the continuing education courses that NISDA offers. And ce@nysdental.org is an email address to get in touch with our CE department. I highly recommend putting things in a CE Navigator. New York State is pretty nuanced with they're very specific with what they require for licensure. So our CE department is very, very good at making sure that you are compliant with what their requirements are. Practice management does not count towards license renewal in New York State. So if you take a lot of practice management, you take a marketing course, that's fine. You can do that for professional development, but that is not going to count towards your 60 credits for licensure. So make sure that you know that the courses that you're taking, they might be good for professional development, but they might not count for your license renewal. So I recommend scheduling in the final year before your license is going to renew. Reach out to the CE department and go through and have an audit done of you, making sure that you are fully compliant before you submit for your license renewal. And that's really a unique offering from the association that is not offered with many other professions. This is not a given of association management, and some states don't even offer it. So if you're going to a different state, ask them and see what CE resources they have. But New York State does offer that, and it is free. It's included in your dues. So take advantage of that to make sure that you are compliant.
Yeah, it's a great resource, that course auditing. I think also for me too, as a general dentist, I'm a member of the Academy of General Dentistry. And they have their transcript. A lot of courses will either be ADA CERP certified or they'll be AGD PACE certified for a lot of, at least as a general dentist. Patrick might have a different certification as a specialist, but I like both. I use both of them as tools because the AGD, their transcript will give you different clinical categories that their CE falls under. So you're like, okay, I took 7 hours of oral surgery and I took 6 hours of restorative dentistry. So you can kind of keep track of the variety of courses that you're taking as well as just the hours too. So both of the resources, I like the CE Navigator because I can put on alarms as a reminder, this is going to be, my BLS is expiring. I need to make sure I renew that before it expires or things like that. So there's great tools for both resources for tracking your CE and taking certified courses. Okay, so I think in our last lecture panel series, as well as this evening, I think we've touched on things about, making things that'll stand out in the job market, as well as advice on what to invest in early in your career. So if we have time at the end, we can kind of reiterate some of those thoughts. But I'm going to kind of see, Morgan, if you wanted to tackle a little bit and talking about case selection and treatment planning, because I feel like we've kind of, mentioned it, but not really kind of dived in a little bit more in detail.
Yeah. I guess as far as treatment planning goes and case selection, definitely want to challenge yourself, but don't want to overwhelm yourself in the beginning. I know at our office now, we like to do a lot of big implant restorative cases, a lot of cosmetic cases, hybrids, but would I be doing that in my first month of private practice? Personally, I wouldn't. If you do have big cases that land in your lap, it's not a bad idea to ask your boss or senior associate or a mentor for help. It stinks to possibly lose production in the beginning, but if you can see a large case go successfully to completion, like a hybrid, then you'd be better prepared for the next one. So just something to think about is, seeing cases through, but maybe having somebody look over them with you. I think, again, it always comes back to having a mentor or somebody that you can do some peer review with. to go over those big cases and make a plan of attack.
So excellent. Anybody else have any thoughts about treatment planning and case selection when you first graduate, or how you kind of graduate yourself to doing more advanced cases? No? No thoughts? Actually, Morgan, I had a question. How did you kind of, prepare yourself or gain experience to be able to do some of those bigger rehabilitation cases, or doing those like hybrid cases? Like what, did you do specific CE? Like what kind of was your process for getting comfortable to do those cases?
Yeah, so I really did initially have one that kind of did fall in my lap early on. And thankfully, my sister had done a couple of arches. So again, having somebody that I worked with, somebody that I look up to and feel comfortable with going over that. And then the more that we realized that we had a pretty good patient population for those cases, we started to go to more CE courses, starting small and locally, and then eventually traveling a bit more across the country for them, aligning ourselves with just a few specialists that we know we can work with, aligning ourselves with a great lab that can work through these bigger cases as well. And then, yeah, I just with time became much more comfortable with them. But in the beginning, it was the most daunting thing.
Awesome. Thanks for sharing that story. Anybody else thoughts about treatment planning or how to graduate yourself to bigger and more complicated cases?
One thing I notice in our clinic setting, if one of my like junior staff dentists comes to me with a large case, I'll suggest and come up with ways that we can work on it together. Like for example, them handling a fair amount of the operative, and then tackling some of the fixed work, and then when it comes time for how we're gonna open up the VDO and maybe crown the anterior teeth and stuff like that, to complete like a rehabilitative case, just approach it from the idea that, well, I can't fit all this into my schedule. Let's bust this up into our schedule a little bit. And then, talk to the patient and say, this is Dr. So-and-so, this is me. We're going to kind of work together on this. We're going to kind of quarterback this a little bit, but both of us have different skill sets and stuff like that. And we want to get this done for you in a timely fashion and stuff. So I think early on, if I had to look at it from the other perspective, if you could just approach your colleagues, or maybe, the more senior dentist in the practice you're working in, or perhaps, if you're in a more clinical setting and stuff like that, just looking at it from the perspective of how can we fit this in so it's in the patient's interest, but then also like, you can't, it would be really difficult to spend an entire like 8-hour day, prepping 16 crowns or something like that, that you're not going to see any production for until you cement them all in or something like that. I'm just looking at it from a productivity standpoint and stuff like that, So, it's like eating an elephant, one bite at a time, just a really big case, just break it down into its smaller parts. And then just kind of come to your colleagues and stuff like that and say, hey, can we work on this together? I think saying, can we work on this together, definitely goes a little bit more with your colleagues than saying, this looks tough, I really don't want to do this. Can I refer this person to you? I'm like, you totally can. I'm just not going to be able to do it for 6 months and stuff like that. Do they want to wait that long, or are they just going to go to another office or something like that? So find a way to collaborate and work together. That would be my advice.
Yeah, that's a great idea. I love that, Dr. Solomon. Thank you. Okay, so last section here is, talking about what other opportunities exist beyond clinical practice. So with regards to like getting involved maybe in academics or public health, or getting involved in organized dentistry, what other ways can people get involved in dentistry beyond just seeing patients? And then, how do you kind of balance those kinds of extracurriculars with your practice? So I'll start with Patrick. Any kind of insight or thoughts on that?
Yeah, from a pedo perspective, obviously maybe a little bit different, but I mean, I've had just a lot of, I feel like, practice fulfillment doing this right here with you guys. I've all you panelists are incredible people, and just getting to know you all and Heather and things like that. It's actually provided me something that private practice really hasn't, a different sense of camaraderie and stuff like that. So I would just highly recommend everybody out there. Like, and I wasn't the biggest organized dentistry guy, like in dental school either or anything like that. I kind of was like pulled into it by one of my other colleagues, James Wanamaker. He kind of yanked me in and said, hey, give it a whirl. And I'm glad he did. So just, be open to just being involved, even if it's small locally in your local dental society. It's extra work sometimes, but I think it gives you a good sense of, just belonging and camaraderie. And then also from a people perspective, I think small community service things I hold near and dear to my heart. I just went to a elementary school the other day and, read some dental books to about 3 or 4 kindergarten classes. And it's one of the more special things. I didn't get a cent of production out of it, and I never will, but my gosh, it was great. And the families were happy, and the people that ran the programs for these kiddos were happy. So find something else that's related. I feel like that gives you a little bit of joy and just gives you some interest and things like that. And this can be different for everybody, but I think it's important to branch out a little bit more professionally than just private practice. It gives you just a different community vibe. That's my take.
That's adorable. I love that, Patrick. Thank you for sharing that. Morgan, how about you?
Yeah, for me, in the beginning, when I was still trying to build up my time at our office, I would work at a local hygiene school at the community college. And for me, it was just a nice change of pace, being outside of private practice for a couple of days in the week, working alongside students in the clinic. And I think I might have mentioned it last time, but just building good relationships with hygienists that were going to be entering our community was really, really nice. Even to this day, I haven't been in the clinic in a year or so, but I'll go back for certain lectures. And when we have colleagues who are looking for hygienists, they'll contact my sister and I, and we can help kind of place people, and it works, wonderfully for both dentists and the hygienists. So I found that to be a really nice outlet.
Wonderful. Thanks, Morgan. Evan, how about you?
I would say, start local with your involvement, whether, it's in dentistry or anything else. A lot of times, as a healthcare provider in your community, you're well positioned to serve on different boards. And, a lot of times you get asked to be involved with a not-for-profit or, schools or health facilities, all of that. Those are great ways, to give back and volunteer your time to your community. And it can be really refreshing. But then within dentistry, locally in Western New York with the 8th District, that's where I have a lot of my mentors and, people who have been through what I've been through, in a multitude of different years of experience. So you have those people to ask, how did you handle this transition or that, or, a staffing issue that, you might be running into, or just as a whole, it's really nice to stay involved and, keep in contact with different colleagues, and whether that's even through a study club or different groups, or if you want to teach, just like Morgan had said, I teach in a residency, but there's, if you have a dental school nearby and they have positions opening, sometimes, they're always looking for people in pre-clinic or the clinic floors. And those are another way to be thinking dentistry, but maybe not, clinically. So that's refreshing to, take a step back from the holding the handpiece, but to be evaluating work and teaching it in a different capacity.
Awesome. Thanks, Evan. Joe, do you have any thoughts on it?
If you guys see me shaking my head, it's because my dogs keep going nuts every time. My son just got home, so he's so if I'm shaking my head, it's not because I'm disagreeing with what he was saying. I'm like you dogs, knock it off. I within our tribal health center, I guess I'm lucky that we maintain a very good affiliation with University of Buffalo's dental school. We have AEPD, so advanced education pediatric dentistry residents rotating with us right now about once a week. 4 residents come out and do oral conscious sedation with the dental anesthesiologist, and they see some of our patients just that need a little bit more than nitrous, but not quite ready to go to the OR and stuff like that. So we've had that relationship. And then we have summer interns that are D4s that rotate with us. And we also have an internship in the fall for dental students. I think I've been able to really stay involved with it by taking those students who come for clinical internship and then adding like a public health component to it and stuff like that. And by doing that public health component, we've created like a 1-credit elective course for the fall for dental students. So this is my first year of like actually like instructing an elective where I can give people a grade, and then also have like some didactic components on ideas for expanding access, examining oral health disparities between native and non-native children, looking at barriers to care and social determinants of health and stuff like that. So it definitely provides a unique opportunity in the clinical setting that I'm at, where we have the affiliation with the dental school. So I definitely have enjoyed that aspect, feeling that I can do a few other things than just my clinical dentistry and my management of the department, where sort of like maybe, I know it sounds corny, but like maybe like inspiring like the next generation to pursue work at an FQHC or in the public service and public health sector and stuff like that. So it's definitely nice to have that ability. I would say for people like about to finish their residency and get into a practice setting and stuff like that, what I would really strongly suggest is just look for those opportunities and stuff like that. Like Katie, when you finished, I don't think you anticipated that you'd be starting a GPR or an AGD program. You probably didn't imagine that you'd be a residency director within 5 years of finishing your program and stuff like that. I never thought that I'd be like a part-time faculty at the dental school and stuff like that. Like I couldn't get out of that place fast enough and everything. But maintaining that involvement, and I think maintaining that involvement and maintaining those relationships is definitely important. So I totally agree with everything that all of my colleagues have said. Absolutely.
Yeah, so, and I will wrap it up too. So one of the reasons I love working at a federally qualified health center is because it's already built in that we do more than just see patients. We're involved in the community. I'm going out to the farmers market for Pediatric Oral Health Month and educating families about like the sugars in their foods and like doing brushing activities with kids. We're marching in the Pride Parade next month and also tabling and promoting health amongst the LGBTQ plus community. So those are things like I get to do just as part of like the job that I have and the place that I work at, which I love. We're also collaborating with, the local community college for hygiene and dental assisting students to come work with us and rotate with us, which has been a fun experience to kind of, teach and mentor. Also getting involved in the dental association, both locally. And I mean, I would say getting involved, like I definitely agree with everybody to start local. Maybe if you felt you've been a bit more involved up to this point, you'd want to be, get involved at a state new dentist council position, or serve as like your component chair. So you can come join us on the new dentist committee. But I would definitely, kind of don't say yes to everything. I think that's something that like I've definitely bit off more than I should have my first couple of years out, and I've kind of spread myself a little thin. I mean, I love everything that I'm doing, but there's certainly days that are like, oh boy, how am I going to juggle all of these things and, commit to everything that I want to commit to. So, but other things too that you just want to, I'm going to just, rattle off some organizations you can keep an eye on if you want to do dental things out in the community. One is Rural Area Medical, it's RAM. They do different dental and medical one day in rural areas to provide free care. There's also Missions of Mercy. There's also Special Olympics does events all over the state. The New York State Dental Foundation, they will do different screenings. They'll host different events and community related events, and they're always looking for volunteers for those. Another organization, Planet Smiles, which is owned and operated by a pediatric dentist who is from Muskogee and also on faculty at Buffalo. She does pipeline programs for middle school kids and high school students, and she's looking and trying to expand that throughout the state of New York. So if you want to get involved as a volunteer, or, you know, when you get into practice, you're like, you know what, it'd be great to help, you know, create a pipeline to inspire kids in this community to go to dental school or to become a hygienist or become a dental assistant. You know, reach out to Planet Smiles and get something going in your area. Also, lessons in a lunchbox. Similar to Patrick going to read tooth-related books to kids. Lessons in the Lunchbox, I think, is 3rd and 4th graders. You go through a free training, and then you get a partnership with your local middle school. And when you have a service agreement signed, you can then say, hey, Lessons in the Lunchbox, I need 200 lunchboxes, and then get a team of other dentists or other dental auxiliaries to go and do education in schools about nutrition and toothbrushing habits. It's a really fun program that was, again, started by a dentist, Dr. Booker, down in Maryland, and now it's a national program. So there's a lot of different things out there just based on what you're interested in, whether it's through a dental organization or a non-for-profit, that really, you know, kind of reinvigorate your excitement and love for dentistry when the day-to-day clinical practice can be a slog sometimes or emotionally draining. Those are the things that remind yourself, this is why I love this profession. So definitely get involved in those activities, or advocating too, especially right now. A lot of things are, you know, on the chopping block or at risk with fluoride supplements and fluoride in the water. Like, we need dentists now than ever to be, you know, going to legislators and advocating and just educating the public and insisting, like, this is safe, this is tested, you know, please trust in these products, please, you know, and kind of teaching people how to properly discern what is fact and what is fiction. And things of that nature. So, you know, now your voice is even more important to get involved in those kinds of things, even if you've never done it before. There's very easy things like call to actions. It's a templated letter that, like, New York State Dental Association or the ADA will send and be like, hey, please send this to your congressman. They'll even find your congressman for you. You just put your name in it and press send. Things of that nature, or going to a lobby day event locally or nationally. And things of that. I think those are really going to be, over the next couple of years, important things to get involved in. So with that, we've gone way over this evening, but I hope those of you who've stayed on have gotten some, you know, helpful nuggets of information. If you have any additional questions when Heather sends a follow-up email, please, you know, send any questions that you didn't feel like we covered. We will get back to you and getting those answers out to you. And like I said, the slides that we went over for licensure will also be on there. So thanks so much for sticking with us till almost 9 o'clock. We really appreciate it. And we hope that, you know, this will be helpful for you. And we're so proud of all of you for almost being done in residency and joining us as early career dentists. So way to go. You're almost there.
Thank you, everyone. We have still a lot of links, a lot of things. We actually have a little, you know, file that we're working in here. So I'm happy to provide all of that in a follow-up email as well. Things that maybe we weren't able to get to. And please reach out. You know, I'll just throw my email in the chat. It's concierge@nysdental.org. And just reach out to me anytime, and we can give you any follow-up information, but you will be getting some follow-up documentation. If anybody does have any questions, we're happy to just answer them in the last couple minutes here. You took your time, we had your time tonight, so if you want to go ahead and ask any questions, the floor is yours. Otherwise, we can go ahead and wrap it up. Okay, I think we'll call it there. Thank you so much. Thank you to our panelists. Our promotion was put on tonight by Milmick. It's our sponsor, and thank you for joining us.
Night, everybody. Thanks for tuning in.
Congratulations. Good luck.